Hello, everybody. Jon Thompson with Community Connects, here again with our podcast, The Connection. Today is a very special day. We have the honor of having our great partner and friend, Dr. Eliezer Lappots from Health Horizons International, stationed in the Dominican Republic. We've been able to partner with them. We've had the great opportunity to partner with HHI over the last almost 3 years now. And it's a pleasure to have you on the podcast. Eli, how are you today?
Thank you. How are you? Hi, everybody. Thank you for having me, John.
Today, we want to catch up with all that's going on in the Caribbean. The island of Hispaniola is very unique in that there are two countries on the island, Haiti and the Dominican Republic. Dominican Republic has been, unfortunately, the leader of cases, I believe, in the Caribbean regarding COVID-19. And it's as we look to, as the world begins to reopen, as communities begin to try to get back to normal, I think we're seeing a rise in the cases, more testing, and with all the news that's out there, it's hard to kind of find one source that has news from the ground. And so this is an opportunity for us to connect with someone who is who's living, who's working in the Dominican Republic, and can give us a firsthand account of what's happening. So, but first, tell us a little bit about yourself and the organization. Our audience might be learning about HHI for the first time.
Of course. Well, I'm Dr. Eliezer Lappots, and I am currently the Executive Director of Health Horizons International Foundation. Before HHI, I have been working with NGOs and in the diplomatic world for about 11 years. I started working at the Department of State as a coordinator for the International Relations Program when I was 18. And then during college, I started participating in a lot of NGOs and doing a lot of community work, concentrated in public policies. And basically, my career evolved going from working directly with the government, implementing policies that are inclusive and really bring resources to disadvantaged communities. And then I started moving more into working directly with communities. I live in 16 countries, implementing community health programs in Somalia, in Ghana, working with chronic diseases, specifically like HIV, diabetes, hypertension, cancer, respiratory diseases, and cardiovascular diseases. Then I really started developing a passion for human rights. I joined Amnesty International, and I was working with a couple of countries. I became an immigration and human rights lawyer. And here I am in HHI now, leading programs related to community health in the North Coast, specifically in the Puerto Plata province, more concentrating in vulnerable populations.
We have brought students to work with Health Horizons International from the United States on service learning trips, and we have been able to gain a very rich understanding and appreciation for the communities where HHI works. We have been able to meet community leaders, health promoters, program staff, community partners like hospitals and clinics and other organizations doing incredible work there. It's been a blessing in disguise. We had to go to the Dominican Republic largely out of necessity after the social unrest in Nicaragua in 2018. And to find such a strong partner on the ground doing the good work every day has just been reassuring to me that there is indeed a strong network of agents of change from
Mhm.
the tops of organizations, say the grass tops, all the way down to the grassroots, and in the Dominican Republic. So I just wanted to say thanks for opening the doors for us and our community to be part of the work and vision that HHI has for the community. So real quickly, I know that your programs, there's primary care, there's prevention, you work with health promoters as well as regional kind of clinics. Can you give a brief description of some of the primary programs and how might have they been affected by the ongoing coronavirus pandemic?
Perfect. Well, basically, let me explain a little bit of what HHI is. HHI was founded in 2009, but before that, before the organization that you know now, HHI started basically with medical service trips conducted by doctors that come from Connecticut, and they were offering free primary care services to disadvantaged populations in Montellano, is a municipality in the Puerto Plata province. This is the headquarters of our offices. And basically, after the MSDs, the doctors really saw a necessity of implementing a more permanent structure. So that's why they decided to found HHI. So HHI is founded in 2009 in Connecticut and is incorporated in the DR in 2012. Like you mentioned, our core is community health, and community health is compounded by different topics or different areas. It's not only medicine. So what we have done is moving a little bit away on discussing the topic of community health as something strictly clinical, and moving on incorporating things that are called the determinants of health, and how other things like employment, education, gender disparities, racism, structural violence affect the population's health. So we have come with a couple of programs where we try to find sustainable solutions, incorporate the participation of the community in their own development and in their own decision-making process regarding their health, building local capacity, strengthening the public health system, and identifying leaders in the communities that can take on the role as community health worker, and they can invest in their own communities. Basically, the idea of our model is ensuring that people of color and Dominicans and Haitians are the ones that are coming together in finding their own solutions, because we understand our circumstances, we understand our history, and we understand the necessities of the communities more than anybody. So we work with, we have 7 programs right now that are active. The first program is the chronic care program, and here we have a family physician called Dr. Stephanie, and she offers medical attention-free primary care services, home visits to those patients that live in remote areas that don't have access to going to a health center. And she works in collaboration with the program of referral. So for those patients that have conditions that need a little bit of a special care, like for example, with cancer, a cancer treatment, or they have to see a specialist, we connect them with other health centers or other clinical institutions that can give them that further care. For example, if we have a patient that is living with cancer, we connect them through the cancer patronatus, and is a collaboration that we have identified with a lot of NGOs and medical institutions in order to provide that further care that maybe doesn't fall into the HHI basket, but because basically our idea is to connect the patients to quality and affordable healthcare. We design these partnerships in a way to ensure that they are being taken care of. The third program is the Community Health Workers Program. Is one of the most exciting ones in the Dominican Republic. Here in the country, we are the only organization that is certified by the Ministry of Health, Ministry of Public Health, and the National Health Service as the only organization or NGO in the country specialized in community health, with a concentration on chronic care. So it has been demonstrated that having a community health program really help us close a little bit of the gap in terms of the necessities of chronic care. So we identified leaders in the communities, and we train them and develop their skills on everything that has to do with primary care attention. And they learn about vaccination, chronic care for people living with diabetes, with hypertension, with cancer, with respiratory diseases. They learn the basis of medication. They can conduct medical service trips. They can conduct mobile clinics, home visits, and all of that is coordinated by Eliza, which is our program coordinator, but also receive the support from Dr. Stephanie, which is our family physician. And basically, the community health worker is a nurse, it's a counselor, is a psychologist. They are our eyes and ears in our communities, and basically they serve as a bridge between our organization and the services that we want to provide and the people that live in the community. The next program is the education, prevention, and integral management for diabetes and hypertension. And we work in collaboration with the World Diabetes Foundation, the Ministry of Public Health of the Dominican Republic, and the National Health Service of the Dominican Republic. And this is a very, very huge project that we carry in the three provinces of Santiago, Puerto Plata, and Espaillat. And basically what we do here is that we train doctors, nurses, and community health workers from the public health system in order to improve the way they navigate chronic care, with a concentration on diabetes and hypertension, but taking in consideration, of course, how diabetes and hypertension complications can lead to other type of diseases. Each year we train about 250 doctors, 240 nurses, and 230 community health workers from the public health system. We are in charge of supervising 170 units of primary care across the Dominican Republic, with an outreach of 1.2 million people within that region.
That's really incredible. I mean, let me just say, 1.2 million people. That is not a small number.
No, and it's only 12 staff members, so it's a huge deal.
Well, you can make a little bit go a very long way. I've seen it happen.
Definitely.
Your staff are amazing.
Definitely. I think
incredible.
I have been blessed with the best team ever. I think that we're so resilient, and we all come from different backgrounds, but we have come together in a space where we are all aware of the necessities of the communities, and I think each of us from our different perspectives, we have been very successful at bringing solutions. And it's people of color, again, Dominicans and Haitians coming together and participating and leading this conversation. Our next program is our strengthening HIV services and systems, and that's a collaboration that we have with USAID and FHI 360, which is the implementing agency in the country. And basically what we do there is taking the community health approach on HIV and providing free HIV testing in the communities, identifying the vulnerable population. Before the model of HIV was such as a lot of models before the community health one, is that patients used to go to the health centers to receive the services. So with the community health approach, the idea is for us to send the services to the step of their doors. So that alleviates a lot of the challenges that our population have. And specifically with this project, what we have been very successful at is ensuring that anybody that is at risk receive the counseling and receive the education and the prevention on HIV and other sexual transmitted diseases, providing them with the free testing, connecting them with the free antiretrovirals and treatment at the system of integral health, which is a specialized hospital on the second level on the Dominican public health system. But most importantly is ensuring that the person that is living with HIV receives a complete care. So a lot of the challenges that we're having in the Dominican Republic is people that live, just like in other countries, people that live with HIV are at risk of developing all other chronic diseases. So our approach is not only providing going beyond the retroviral, so beyond providing the treatment and connecting them with the services, ensuring that they are being taken care of and they are receiving a complete health service. Our next project is Sano y Feliz, and basically what we do in Sano y Feliz is create support groups led by our community health workers, where people learn about how to implement and adapt healthy habits into their daily days. And the thing with us Dominicans is, we love our good fried plantain, we love our rice and beans, we don't like to exercise, and we drink a lot of beer. So that might be fun for the short term, but in the long term, that can be harmful. So the idea with Sano y Feliz is normalizing the conversation on healthy habits and how us as Dominicans, we can adapt those habits and improve our health. And we do it through 6 core areas. The first one being education. And education and prevention are basically the first prescription to avoid the development of chronic diseases. We create educational materials in Spanish and Creole, and we conduct community workshops with the support groups in the communities, led by the community health worker, and they learn about nutrition, how to read their labels, how to what's the healthier version to cook un mangosito. If you want to eat some good old Dominican fried cheese, you can pan fry it. You don't have to have add extra oil. But beyond that, in terms of education and nutrition, we also have general well-being. So they participate as Zumba classes, exercising classes. We have a mental health unit where we have a community psychologist that come in like a counselor and teach them about what type of things they can include in terms of ensuring that they have a healthy mental health. Depression, for example, is a chronic disease. So sometimes people is not really aware of how important is keeping your mind in the right place, especially during times like the COVID-19. So we have that support from that psychologist to give our beneficiaries those informations and those tips that they need to ensure that they have a proper mental health. We have a community development and social empowerment unit where we collaborate with the UNDP, the United Nations Development Program, and other international agencies and local agencies in order for us to bring sustainable solutions to issues like sanitation, clean water. We conducted an investigation with cholera. It was a cholera outbreak in one of our communities. So we, for example, in the times like where tropical diseases are in season, like for example now in summer with mosquitoes, bringing that awareness within the communities. We have conducted dental medical service events where we provide free dental care for people living in the community. Women's health, vaccination events. So Sano y Feliz now is pretty active, and now with this new agreement with the UNICEF, the idea is for us to utilizing the same community health model, start implementing projects with nutrition and childcare last project is led by Joaquin, and is our community development program. And basically, that's where Community Connect and HHI comes together, and we hopefully we'll start resuming those activities on the constructions of floors, home improvements, water filters. Recently, we were in conversation with the UNDP, the FAO, which is the Food and Agriculture Organization. It's a unit of the United Nations. And when I was living in Santo Domingo, I worked with all of these international organizations. And also when I was living in New York, working as a diplomat, I worked with the UN. So it really we really came to a realization that 10 years in history in HHI, for us, it was extremely important to first be part of these international conversations, redefining what is community health, and understanding that the community needs are sometimes beyond medicine. And these social, economic, and political determinants have a really huge impact on a community and are decisive factors in determining if a community is healthy and happy. So that's basically our programs.
You know, I'm always amazed at how much y'all do. The holistic approach is not the easy way. It's not the quickest way. But I believe 100% that it's the right way to approach our efforts to partner with local communities in ways that promote dignity, equity, and responsible, sustainable initiatives, right? And I think you as a person and a professional, as well as the organization, not only talk the talk, but you walk the walk. And I've seen that personally. And I look forward to many years of collaboration with HHI. It has opened my eyes to a lot of things, a lot of the challenges that I have seen and observed in the Dominican Republic that I've also seen and experienced in Nicaragua. And so what I've learned from collaborating with HHI has enriched the programming and the work that Community Connect has done and continues to do in Nicaragua. What I want to ask, because HHI works with so many different kinds of vulnerable populations, whether chronic patients that are diabetic or hypertension. You talked about work with HIV populations, people living with HIV. I'm interested to know how those communities, those populations have been impacted by the current pandemic, and how HHI has adapted in some way, shape, or form to meet the needs of those vulnerable populations during this very challenging time.
Definitely. So basically, let me start by telling you and the folks that are watching us a little bit of our communities. So we're allocated in the north coast of the Dominican Republic, specifically in the municipality of Montellano. Montellano had a very interesting history because we had a sugarcane field and a sugarcane factory. And the people that were living in the communities, the majority of them were Dominicans that work in the factory, but they also have Haitian immigrants that work in the factory. Once the factory was closed, then the economy was really affected, and that led to a lot of what we're seeing right now within our communities and a lot of the deficiencies that we see. Why did that happen? Well, one of the things that happened in the Caribbean and with the economic model is the economic model switched from agricultural to a more industrial model, but it was a model based on exploitation. So once the factory left, the community was so dependable that they fall into a complete political, economic, and social crisis. So the populations that we serve right now are populations that face lack of education, lack of public services like clean water, sanitation. There's a lot of gender disparities. Unemployment is super high. There's a lot of infrastructural barriers, for example, geographical, as you have seen whenever community document comes, the streets are destroyed. Usually, in order for you to reach somebody that lives in more of the higher mountain, there's not like a proper street, there are no bridges. So add that, all of that with weak clinical infrastructures, structural racism, discrimination, and of course, there's a lot of tension, racial tensions among Dominicans and Haitians because of the history. So we live in a country where we have beautiful resources. Our GDP is growing every year, but that is not reflected on the realities of those populations. So we can say that maybe there's not a good distribution in terms of wealth, that in access of health and other services is due because wealth is concentrated more on the urban areas, not in the rural areas. So there's not a lot of investment. Immigration is also one of the biggest, immigration policies specifically is one of the biggest challenges that we have in the DR. And of course, the Haitian minority is the most affected in this sense. So when you add all of that, that is the perfect recipe that I would say contributes to the high incidency of chronic diseases in the country. And when you get into the profile of our patients, adding all of that up that I just mentioned, and with the lack of sustainable housing, the lack of employment, the lack of economic resources, even access to a river or access to recreation, that creates the perfect atmosphere for an unhealthy community. So we try to move away a little bit from the paternal model that the community, that the Dominican Republic has in terms of health, and moving that a little bit to a point where the patient participates a little bit more in the decision making regarding their health. So with the COVID, what the COVID did is, I will say, uncover that those deficiencies that were already existing in the country. And of course, the population was more affected. When the COVID started spreading in March, one of the first things that we did in our office is we were waiting for the national declaration in order to examine what type of approach we were going to take. But because my experience with Ebola when I was living in Africa, I knew that we could not rely on the decision of the government, and we have to take our decisions ourselves as an NGO. So in that sense, what we did is aligning all of our programmatic activities and preparing for a remote community health approach, ensuring that our patients were receiving their monthly medications, that they were being seen by a community health worker, they were seen by Dr. Stephanie, and ensuring that despite the social distancing, we were keeping ourselves more closer than ever. So in that sense, the COVID affected our population very drastically. For example, there's a lot of people that depend on informal economy. They sell beans, they sell rice, they sell milk. So that was really impacted by businesses that were closing and they were not purchasing those goods. A lot of people that work in the hotel and tourism industry were really affected. A lot of employees were laid off without no payment. People that don't have house, they cannot do the at home like shelter law or anything like that. A lot of health clinics didn't have the capacity to deal with other chronic diseases or other diseases. And with the COVID, Some of them closed and some of them dedicated their operations with COVID specifically. So if you have other conditions like an emergent surgery, they were not receiving you. Test availability during the first month was really, really, really low, and it was concentrated more in urban areas. So the people that live in the rural communities didn't really have access to that. So I think it was a very challenging moment for us at HHI because we have two choices. Either we close our operations and we stay at home, or we fill up the gap that the public health system had in that moment and live up to the promise that we once made to the communities. That basically the reason of HHI's existence is because we try to fortify and strengthen the public health system. We are aware that there are a lot of deficiencies and that the people in the rural and vulnerable communities were not going to receive those services. So in those 2 weeks, you remember I myself had COVID. I was sick, but despite the pain and all of the challenges that I was experiencing myself regarding my health, I knew that people depend on us. And if I didn't stand my ass out of my seat and do what I'm supposed to do, then people were going to die. So basically, our staff have a remote meeting 3 days after my diagnosis, and we plan how our medical service trips were going to look like. We start designing educational materials for the communities in Spanish and Creole. We start implementing sanitation stations with soap and water on touchless dispensers. We were leading basically the conversation on prevention and education and information access in the rural areas on the North Coast. And I think it was an opportunity for us to demonstrate that the importance of our work, and that if HHI doesn't exist, basically all of these people will not have access to primary healthcare. But not only it's about healthcare, it's about accessibility, it's about justice, social justice, it's about equity. And I think it was a challenge and an opportunity at the same time because because of our outreach and because of our model, it was really easy for us to adapt to the COVID and having that closeness with the communities and the community leaders. We were able to act faster than a lot of government agencies. And while a lot of NGOs were closing their operations and leaving the countries, we remained firm, working every single day to ensure that everybody have access to primary health care.
It's a testament to your organizational, your institutional commitment to the communities where you work. It reflects a decade of relationship building, and really shows the power of solidarity. And in Spanish, this word acompañamiento, which is so important for communities that are often isolated geographically or by systemic structural discrimination, whatever, to be accompanied, to have someone there to share the experience, to be there with them. I think that that's some of the most important work that we do. And it has nothing to do with medicine. Like you said, health goes way beyond the medicine and the diagnosis and it's about just knowing that someone cares about you sincerely. And I just love that our organizations share those core values, those guiding principles together, because I don't think that that's the norm. But what I will say, and I guess as the last question for you, I think we're going to do 2 parts to this interview, or to this conversation between our organizations. I wanted to ask you about what has been revealed as as a positive. That's probably not the right word to use in this day, right? But are there any positives that that you can hope for, or that you see coming out of this experience that's been so difficult for so many people? What are the lessons learned, and what can we take out of this experience that will make our lives and our work more impactful and better going forward? Do you see any hope for positive outcomes?
Definitely. As I mentioned, for example, when the COVID started spreading, we were in Nicaragua, for example, and we didn't really thought that this was going to be like this. Um, but when it happens, and we had our meeting as a staff, the first thing that we ask ourselves is, we're only 12 people, 27 community health workers against a global pandemic. Like, we have so many people that depend on us. We don't have a lot of resources. We have a very small number of staff members, and although we're powerful, are we gonna be able to make it? Are we gonna be able to sustain this? Are we gonna be able to keep providing those services to the people that are looking or expecting us to do it? Versus taking care of ourselves and also like managing the stress and the worry of us as individuals, but understanding that this situation is bigger than us. And in past times, we have demonstrated that we're very resilient, but are we gonna be able to survive this? Right. So I think it demonstrated the capability and the capacity of us 12 staff members leading a change, a small NGO in the north coast of the DR, leading the conversation on community health, leading the voices of people, vulnerable people, and people in disadvantaged situation, participating in the public policy making, participating in the decision making, having reunions with the Ministry of Health. I think it validates our work, and it demonstrates the importance of how our model can be adapted to different situations in other contexts and in other developing countries. I think despite all of the success that we have had, the COVID, like for other NGOs and other companies, these brought people to their knees. And in our case, it made us stand stronger than ever, and we were able to demonstrate not only the importance and the synergy that we have as an organization with the community, but also that despite all of the challenges that we have faced, we also bring sustainable solutions, and we have always fulfilled those gaps in terms of the needs, not only in terms of health access, but in terms of justice, in terms of equity, beyond community health. It's a human rights crisis. And recently I made a publication where I said that poverty and inequity it's the most dangerous pandemic that it's in the world. And the COVID, I think, just reassure the necessity of changing the conversation in terms of the health approach. And it validates that in order for societies to be healthy and happy, there is a necessity of a structural change in terms of how ministries and departments of health in different countries are approaching this situation. So I think that COVID, despite the negative things that have brought, I think it was a chance to discuss and to open that dialogue on what have been the deficiencies on the health systems in other countries, and how collaborating with NGOs and collaborating with other institutions are the key in order to reach populations that have been affected and that maybe it's a little bit out of their outreach, but organizations like ours, like Community.Connect and HHI, have a deep understanding of the community needs, and we are able to compile all of that and ensure that we are able to promote and defend health access or other human rights as well.
Well, I think I learned something new every time we talk. Certainly, when we collaborate, it's clear that we do have some great synergies between the organizations and within the communities where we partner in Nicaragua and the Dominican Republic. And I believe that we have a lot to offer decision makers and policy makers. And I'm also humbled by the incredible impact that HHI has continued to make in the past 10 years and for the many years to come. We learn and we grow the more we partner. And I think that's, for me, one of the great takeaways of this work is I have the opportunity to meet people like you and your staff and work with them personally on the ground. And I look forward, again, as I said before, I look forward to the collaboration, ongoing collaboration that we have between the organizations. I'll suggest that we pause for now and come back in the next week or two and talk about what the next steps are. When we get back to normal, what does HHI have in store? We're not doing everything already. I'm sure there's some new ideas that we can share with our community and raise awareness about what we're doing, and also give opportunities for our communities to come together and help. But I want to thank you for your time, your work. Tell everybody in Montellano that we said hello on behalf of the Connect family and our team in Nicaragua. We wish you the best, and we look forward to our conversation in the coming weeks.
Thank you, and we will wait for you with a hot cup of Dominican coffee as always.
There you go. Perfect. All right. See you later. Take care.
Thank you. Thank you so much.